Hello and welcome. My name is Mike Doherty and this is my channel. I have a rare genetic disease called Huntington's disease. And as you can tell from my talking, it affects my speech and my thinking and has slowed me down a little bit. There's currently no cure, and there are not even really any treatments, although there's some experimental trials I'm working in. It's like having Parkinson's disease, Lou Gehrig's disease, and Alzheimer's all at the same time. And I also have two children, Alex, who's 14, Teddy, who is 10, and my wonderful wife, Emily, who is actually a geneticist here in our town, who actually works with diseases like mine. And so we decided that because not many people know about Huntington's disease, that it would be fun and helpful to start this channel to increase awareness about what happens when you have Huntington's, the shaking and things like that. So anyway, but we're also going to try to create a lot of fun memories and have some fun times along the way. So this is basically going to be me trying to live my best life. And you know, now in my family, yes, we deal with almost everything by making fun of it. I have this sort of almost compulsive need to make fun of things and make fun of myself. So be forewarned, a lot of the videos will involve me doing silly things and, you know, might involve us, you know, laughing and carrying on. Okay? This is not in any way meant to be making fun of anybody else's experiences or anything else that might be happening to somebody else. This is just me doing my thing. Good morning. Today is July 10th, 2019. Yes, it is. I'm right. Ha! Suck it, brain. Anyway, yes, and I wanted to talk a little bit about sort of where I am and sort of my treatment and things. So, when I was diagnosed last November, I did some research online and found a drug trial at VCU, which has been working very well for me. The trial is called Signal, and it's what they do is they inject me every month with something called a monoclonal antibody, which is actually pretty cool. I did some research, and it's like right now the most sort of badass Buck Rogers-y, you know, space age Star Trek thing there is. There are these antibodies that you can basically customize to go in and attack specific things and not hit other things. And so in Huntington's disease is caused by a mutation on chromosome 3, which causes a mutant protein to form, which gets in my brain and causes damage to the brain. So right now, all the sort of, you know, drug trials are aimed at either slowing that down or trying to stop it from happening in the first place. And we can talk, you know, a lot more about that another time. But the trial I'm in right now is called Signal, and it's supposed to last about 2 years. And I go once a month to Richmond, to Virginia Commonwealth University Medical Center. That's where I am seen by the very awesome Dr. Testa, who is a neurologist, and her team. She also sees me for her Huntington's disease clinic, and I actually just saw her last month, and so they have a whole team of people that, you know, work with people like me and all kinds of things. But anyway, so the Signal trial I've been in since last November, so I've got about another year to go. And you know, the thing about research is that I am a big believer in research for lots of reasons. Probably partly because my wife is a doctor, and you know, we think science is important. But when you do research, there are some, you know, downsides. One is that there's a 50% chance that I'm not getting the antibody at all. I could be getting a placebo, because, you know, in research you have to have, you know, a placebo group to make sure that whatever you're doing is working. And secondly, there's because it's research, you know, I go in and they give me the infusion once a month, and then they have me do a bunch of tests and they do blood work and all that kind of stuff, but they don't tell me how I'm doing, because it's part of the trial is, you know, they don't tell you how you're progressing or not progressing. So that's also, you know, something that I guess I have to live with. And mostly I'm okay with it, but it's a little, you know, unusual, because usually if you go to the doctor and they give you a drug and they do drug, blood work, they would say, okay, your blood values are X, Y, or Z, and it looks like this is working or it's not working. But anyway, so then when this trial ends next year, I'm excited because I just also found out about another brand new trial that they're going to do at VCU. It's gene therapy, which is like, super exciting stuff. Anyway, in the gene therapy trial, they've never tried this in humans before. They use gene therapy for some other things now, like treating metabolic disorders and things, but they're going to take 26 volunteers, drill 10 little holes in everybody's skull, and then inject a virus that's got this DNA packet attached to it. And what's supposed to happen is once the virus gets in your brain, it will start replicating furiously, and then basically make a fake RNA molecule, which will then supposedly prevent the Huntington protein from doing whatever it's doing, which I think is pretty exciting. So the pluses to that are, first of all, when you do gene therapy, you only go once. So you don't go back once a month or something. And so I guess it either works or it doesn't work. And there's a lot of, it's a very exciting idea. The downsides are that it's never been tried in humans before, so anything, all kinds of things could go wrong. Also they have no idea what the correct dose would be, and so they'll be making all kinds of changes as they go. And I also think having a bunch of holes drilled in my head would be a negative, even if they're small holes. So, but anyway, that's the sort of newest cutting edges thing that just came out. Now, I will warn you, they're very boring. Mostly it's just like, they give me an IV that lasts an hour, and that's about it. And then they sometimes have me walk around and stand up and sit down and that kind of stuff because of my symptoms. And anyway, you'll get to see lots of the symptoms in my other videos that I've been filming. Wiggling and twitching and that kind of stuff. And forgetting things. Hey, if you liked what you saw, like me, subscribe to my page, or leave me comments.